Danger, the first stage of the action plan. This is done to ensure the safety of yourself, innocent bystanders, and the casualty. Hi, everyone stay back. My name is Richard. I'm qualified in first aid. There is no more danger anymore. The purpose of the response phase is so you can gauge the level of consciousness of your casualty. Sir, can you hear me? Squeeze my hands. Blink your eyes. Sir. Are they conscious? Are they semi-conscious? Or they're unconscious? Hey. No response. Still no response. The infant is deemed to be unconscious. The next phase, send for help. The primary means by which we contact the emergency services in Australia is 000. We also have an alternative number being 112. This, however, can only be used on digital mobile phones. To assess the casualty's airway, we place one hand on their forehead. Using the pistol grip technique, we support the chin, look in the oral cavity, the mouth, to see if there's any obstructions. If there is an obstruction, we sweep the mouth free of the obstruction. If we cannot remove the obstruction, this is when we will turn them on the side. Breathing phase of the action plan. It's at this point we determine whether the casualty is breathing by themselves or if there is a need for CPR. To achieve what we call look, listen and feel, we need to provide adequate head tilt with chin lift. We then place our cheek down near the mouth and we look, listen and feel. We look for rise and fall in the chest. We feel for breathing on our cheek and we also listen for the breath. If the casualty is not breathing, we need to commence CPR. What you must emphasise is the compression of the chest 1/3 the depth of the chest. I will demonstrate each of the three categories. The first one, the adult category. We interlock our fingers. We lean forward so our shoulders are directly over the centre of the body. We pivot from the hips and use our upper body weight to compress the chest. When we compress, we should be using the heel of our hand. The palm of the hand should not come in contact with the chest. The heel of our hand should be placed on the flat bone of the sternum and we compress through the sternum to compress the heart. I'm going to demonstrate now delivering the breath on an adult. To deliver the breath effectively, we need adequate head tilt. To deliver the head tilt, we place one hand on their forehead, we grip the chin, we block the nose off, and we deliver the breaths. We should deliver 2 breaths in 2 seconds, and between each breath, observe the chest, look, listen, and feel. You'll notice that after each 2 breaths given, we then give 30 chest compressions. Now let's put all of that together and look and see how the action plan achieves effective circulation of oxygen to the brain. Everybody stay back. My name is Richard. I'm qualified in first aid. There's no more danger anymore. Sir, squeeze my hands. Blink your eyes, sir. There's no response. Can you ring an ambulance? Ring 000. Tell them I've got an unconscious male. Thanks. Get back to me. Airway. Clear. Breathing. Not breathing. Compressions. Dirty compressions. Two breaths. Now the recovery position is used to put someone up onto their side so that we can maintain a patent airway. If we leave a person laying flat on the back who's unconscious, all their muscles in their body relax. The tongue will fall back and block the airway. So what we need to do is put them into recovery position to maintain that airway and to allow any obstructions, fluid or vomit to drain freely. There are 3 easy steps to do this. 1, we grab the right leg and we place it over the left leg. 2, we place the left arm at around 2 o'clock. And 3, we place the right hand behind the neck. At this point, we are set to turn the casualty onto the side. If it's at all possible, we want to turn the casualty onto the left. Now this aids in circulation. We do it nice and slow, deliberate, and we keep it under control. Now defibrillators. They're an electronic portable device which delivers an electronic shock to the chest for a person who is in cardiac arrest. On an adult, we place the pads in the top right and the bottom left of their chest. This will enable the pads and the computerized device, the defibrillator, to identify any electrical activity within the cardiac region. Now, anaphylaxis is the most severe form of allergic reaction that the human being can suffer. Some of the signs and symptoms of an anaphylactic attack would be the swelling of the lips, the swelling of the tongue, the very difficult process of breathing. If we can treat the early signs and symptoms of anaphylaxis, we may actually prevent, unfortunately, a death from occurring. The treatment of anaphylaxis is the administration of an EpiPen. They are classified as auto-injectors, which have a predetermined dose of the drug adrenaline inside the device. The administration of the adrenaline is designed to reduce the swelling of the lips, the tongue, the relaxation of the smooth muscle, allowing the person to breathe much easier, and blood pressure should return back to normal. Australia is the country that has the most incidence and varieties of asthma per capita than any other country in the world. The management of asthma requires that we deliver a medication which is known as a reliever medication. What this does, it acts like a bronchial dilator. It makes the tubes down in our lungs, our airways, expand slightly to allow for more air to travel through so that oxygen can be transferred into our blood vessels. Quick identification of the signs and symptoms, that is wheezing, coughing, shortness of breath, tightness in the chest, will allow us to manage the asthma and hopefully allow the person to recover far quicker. Choking is an obstruction in the airway. There are two types, that is a partial obstruction and a complete obstruction. A partial obstruction, the person should still be able to cough. If a person is choking and coughing, we should encourage them to cough. It's when the person has a full obstruction that they may lose the ability to cough, speak. There'll be agitation, distress, cyanosis, which is the blue into the lips, and eventually they may collapse as little to no oxygen will be circulated. Now, there are two techniques that we can use to assist someone who has a full blockage, that is the back smacks or the chest thrust. Bleeding, two types, internal, external. So if someone's bleeding externally, rest, elevate, direct pressure. With the bandage and the dressing, we'll control the bleeding. The pressure is applied, we keep it elevated above the heart. I now place my bandage straight over the top and I secure the bandage. That is now soaking up the blood and also covering the wound to reduce the possibility of infection. When the body gets burnt, the skin is affected. The severity of burn is determined by the depth of the burn within the skin. To arrest the burning process, the treatment is cool, soft, running water. And we slowly pour the water above the burn, so it then flows down over, and then we can slowly move that cool, soft running water over the burn site. Soft tissue injuries, sprains and strains. These are injuries to joint and muscles. A sprain is a joint injury. A strain is the muscle injury. We want to apply ice initially for 20 minutes. But what we don't want to do is put ice directly onto the skin. So if we take an ice pack out of the freezer, we place it into a snaplock lunch bag, or in this case, a specifically designed bag for it to go into, and that is then placed over the joint. Now we've applied the ice for 20 minutes, we've taken it off, we want to give the joint some support. The fallback treatment for all marine stings is hot water. Anything that stings from the land, we use ice to treat it, except for the next 4 things. For those 4, we use a technique called the pressure immobilization technique. Now, this is a technique which is used to slow down the lymphatic spread of the venom. There's not a snake in this country, and we have 19 out of the top 22 that can kill anyone in under 8 hours if we do this technique in 15 minutes.